and invite my colleague Adam Perzynski, who any good idea I ever had originated with Adam in some way, shape, or form. So he's going to tell you about some amazing studies that he's done, and that's going to sort of set the stage. You're going to hear from Adam about people's use of technology for health, and then you're going to hear from Samantha about the work that's gone on in this community to help people get digitally connected. And then from Leon Wilson from the Cleveland Foundation, who brings a tremendous vision for digital inclusion in Cuyahoga County. So with that, I will stop talking and invite Adam.
Is this the pointer? Oh, it's just a mouse. Wow, that was like really kind of you to say that about the good ideas. I sort of think about it the opposite way. I'm really excited to talk about this stuff here today. So I'm going to talk mainly about. I have to go down later. So I'm going to talk about patient portals and broadband internet inequality. This is work that we've been working on for about a year and a half, my colleagues and I at Metro, and with Bill Callahan from Connect Your Community. And one of my favorite things about this project is actually that it originated out of a hallway argument between me and some colleagues. And I sort of said, like, man, I really think that folks who have all kinds of health problems are actually going to be the least likely to use the electronic patient portal, which at MetroHealth is MyChart. And my colleague, Doug Einstetter, he said, no, I think you're absolutely wrong. I think it's going to be totally the opposite of that. And that it's people who are the sickest who are going to use it the most. And so we said, all right, well, we're going to resolve this by getting the data. And so we set out on this crusade to decide, all right, so the data on who uses this thing has to be in there, right? Okay, maybe it is. And so we spent about 6 months figuring out where to find the data. And then we spent another 3 months putting in an institutional review board application to allow us to access all the data from all the people in the hospital. And then when we got in there and we're actually looking at it, we're like, oh man, there are so many cool things that we can do and questions that we can answer that are way better than whether the sickest people use MyChart more or the least sick people use MyChart. And so this is one of those. I have a disclosure. We routinely give these in medicine. I know it's not required here, but I'm co-founder of a software company locally, and I have a current book contract with Springer. And really, I just want to describe, really, if you take away one thing, it's to think about how access to the internet has emerged as a determinant of people's health. So this is a general social ecological model of health, or of social determinants of health. And the idea here is that your health in the center there is determined by all these different layers of things in your life, right? From where do you live, down to who you associate with, down to your own personal health behaviors, and all kinds of other things that you carry along with you throughout your life. But I would actually say that this isn't quite accurate enough of a model, and that we really need to think about inequality as a source of producing health and health outcomes. And I love this quote: inequalities beget inequalities, and existing inequalities can compound, sustain, and reproduce a multitude of deprivations in well-being, so that we can so that when you have inequality, it creates even more inequalities that you didn't have before, and those create even more than that in ways that you weren't even thinking about. And this particular analysis is a great example of that. So our work on this was just accepted by the Journal of the American Medical Informatics Association. It'll be in print within about 30 days, I hope. So there are a few things that, if you don't know much about MyChart, that I'd just like to share. So first is that it seems to actually make people healthier when they use it, right? So people who have diabetes who use MyChart end up getting better control of their diabetes. People who have HIV and use a personal health record like MyChart tend to have better adherence to their antiretroviral therapy, and so then they have better outcomes in HIV. Among mentally ill patients, there was this great study that found that folks are more likely to follow through with preventive screenings after they've been signed up for a patient portal than before. The other thing that we know is that there are some emerging disparities that sort of mirror digital divide disparities in who uses patient portals and personal health records. So we know that blacks and Spanish speakers are far less likely to use it than whites and English speakers. We also know that folks who are poor who are less likely to use it, and folks who are on various forms of public insurance, Medicaid, are less likely to use it. Beyond that, we also know that internet access is a pretty big problem here in Cleveland. And that this data is a little bit older, but really nearly 40% of people have no computer and no internet in their house. That is sort of a staggering number. It's just, at that point in time, it was the second worst in America. So in our study, what we hypothesized was very simply that people who live in neighborhoods that don't have internet access do not use MetroHealth personal health record monitor. So we did that by looking at the logs of who uses it. There were about 305,000 patients in the 3-year period where we looked at the data. We took their addresses from that and we geocoded it to a census tract. You saw on Amy's slide the Federal Communications Commission data on who has internet access. So we were able to tie each patient's address of resident to the neighborhood and look at the rate of coverage, so the number of subscribers recorded by the FCC in that neighborhood as having internet access or not, and converting that to a percentage. And so here's the map from the time period just for Cleveland. We use the whole service area for Metro, which extends throughout the county and a little bit beyond that. You can see in a lot of neighborhoods, nobody has internet. It's 0 to 20%. Almost nobody has it. But really, almost every neighborhood is sort of not doing that well. And then when we look at who uses the MyChart tool, the personal health record, about 3/4 of our patients actually don't use it during that 3-year period at all. About a quarter use it. So that's sort of interesting. And this isn't surprising. Folks who are over the age of 80 are the least likely to use it by age. We see, similar to other studies, we found that whites are more likely to use SNP than other folks of other racial and ethnic backgrounds. Here we can see that uninsured patients, Medicaid patients, and Medicare patients are less likely to use it than commercially insured patients. Note, this is a 2012 to 2015 time frame. So in that time frame, the idea here is that folks, we're split on the Affordable Care Act. So there's a bunch of uninsured patients before the rollout of Affordable Care Act, and then way more people have it. So this is a little bit misleading. And then this slide really shows the rate of who uses our MyChart system by how much internet access is in their neighborhood. And what you can see is that in those neighborhoods where almost no one has internet access in the 0 to 20% bar there, it's really like 1 in 7. And if you live in a neighborhood where people have lots of internet access, it's really more like 1 in 3. And it's this sort of very graded rate of use of the personal health record. So if you think about what I said at the beginning about how, well, if you have diabetes and you can use this and you do better, if you have HIV and you can use this and you do better, if you have serious mental illness and you can use this and you do better, right? And by doing better, I mean you save the healthcare system money because you're in the emergency department less. Your diseases are more well controlled. But if you don't have it, you're not getting those things. So it's actually pretty easy to extrapolate that for folks who are disconnected locally, but probably all across the country, that their inability to use these health information technology tools is actually constraining their ability to live as healthy a life as they might and sort of reach their well-being potential. This is the multivariate model, and so the bottom green line there just shows that if you're in the worst versus the best category of neighborhood on internet access, you are about 2.5 times less likely to use a tool like MetroHealth. I have a couple other quick slides here about a pilot project we did with the Ashbury Senior Computer Community Center down the street in Ashbury with Wanda Davis there and Bill Callahan at Connect Your Community, who couldn't be here today. I think he's in San Antonio. And we had 54 community recruited participants took a class on how to use MyChart, how to get connected to the internet, and how to get an affordable computer. In that project, at the beginning, we found that about 80% of the participants had never used the internet for health information of any kind at all. They'd just never done it. And only 10% had ever attempted to use a tool like MyChart. Afterward, 100% of them said they'd recommend this to others. And then the participants also rated the features of the tool. So one of the things is that, and I think this happens with a lot of technology tools, that folks really don't appreciate the value of a tool until they've had the chance and the opportunity to experience using it. And so in the training class, I think they get a chance, right? They get to log in and see how it works. And so from the pre-test to the post-test, which was about 3 months later, what we found is that people are like, oh wow, it's really cool to be able to send a message to your doctor via a computer, or refill your prescription via a computer, or make an appointment with your doctor via a computer, when none of them had any idea that you could do that before. And so this specific measure was asking them how much they valued or found that activity useful. So that there's this tension between not knowing how to do something, not having the ability to do something, and finding it to be a useful thing to be doing. And so this is just another chart. So from the follow-up data, just showing that really after, so I said, 10% of the people at the beginning ever thought this was even a good idea or attempted to do it. But at the end, it's sort of like everybody's in this highest category of feeling that MyChart is something that they should be doing as part of their ongoing work to manage their health, right? So it's sort of a total shifting of their view about how they would manage their health using technology, from seeing it as like, I don't know why I would ever use that, to seeing it as an integral part of how they manage their health. And this is really the same thing, so just their likelihood of using it. And that's really all that I have.